Hello everybody, coming up in today's video we've got a really interesting case of a cholesteatoma and mastoidectomy, which is this first patient you're watching here. My name is Taylor Green. I'm one of the audiologists here at Audiology Associates. As you can see, I'm flying solo by myself today. Reese is going to be back, but we're actually not together today, so hence the reason why I'm by myself. Now, this is the first time I'm watching this video with yourself, so this is just a kind of a talk over as Reese is working. Now he's using a standard size Zollner tube here, which is the larger of our suction tubes that we use. We got what looks like a load of really hard kind of dry wax here at the entrance. What we generally try to do, knowing the history of the patient first before we do these procedures, we kind of have an idea on what we're going to be expecting behind this wax. Now, we've got to be really, really careful with patients with mastoidectomies because it's very, very sensitive in the ear canal to start with. But when you've had a mastoid operation, you're a little bit kind of more likely to experience a little bit of dizziness when you're having microsuction. So we got to be extra cautious, especially when we're taking anything away from, where the mastoid, so where the bone has been cut away, basically to fight off any infection that's there. If you're new to the channel, what a mastoidectomy is essentially the area sort of behind the ear here. This is like a honeycomb structure, so it's basically little tiny air-filled pockets, and when a patient experiences an infection in that area, it's very, very important to get it looked at quite quickly. Essentially, it's what some of the signs you get is a lot of redness around the side. Sometimes you'll get a lot of swelling as well, and it does need intervention. So you do need it investigated. So what a mastoidectomy is the operation basically is where they cut away that honeycomb structure. So the bony portion, which again we see in the ear canal, which you'll see in a little bit, they have to go inside the ear to cut away that area. And if this is not treated, it can actually be quite serious. In some cases, it can be potentially quite it could be fatal as well. Now this, to me, looks like this patient has had a recent ear infection here. There's a lot kind of going on as well as the operation and the scarring. There's a lot of this like kind of wet or what looks like discharge. Yeah, this is going to be a nightmare to remove this. So we're just gently kind of hovering over the surface of the ear canal here. Again, very, very sensitive area anyway. That bony portion, we need to try and avoid touching in that area because it almost kind of feels like a pinch. If you was to accidentally touch that area, it's a sudden sharp kind of like, ooh, it's not massive pain, but you get this little sharp, like little shooting pain. You think, ooh, that was a bit sore, but which is why we're always really careful. And you can see just at the top of where the eardrum there, you can see there's almost like this little blood spot. And the eardrum itself, very kind of mottled. You can see there's a lot of fluid in here. Top left there now, just above where that blood spot is on the eardrum, that is the sort of what we call the shelf. So that is where all that bone has been cut out. Now in a normal ear canal, that would be perfectly round. Well, in most cases, that would be perfectly round. So I would have personally done the same thing as what Reese did there, just clear it to the point where you can see the eardrum. We are going to have to refer that patient back to the GP just to get that investigated to rule out any infection. Excuse me, bit of a frog in my throat now. And this is the other ear. So yeah, you can see that. So this is also another interesting feature. So you could see just above where the bones are at the top of the eardrum, you could see almost like what looked like a massive sort of retraction and then a load of bumps inside. Now Reese has let me know in this video that this patient has also had a cholesteatoma. So the cholesteatoma is just a build-up of dead skin that just skin and keratin that hasn't migrated properly, and it does. In most cases, it kind of builds up in that area at the pars flaccida, the top portion of the eardrum. So we've only a little bit of wax in that ear there, but we've got, this is the second patient now. So there's two patients I forgot to mention at the start of the video. So this second patient here has been using cotton buds. So bit of a pain, or Q-tips if you're from America. The Q-tips, a lot of people do kind of, they use them to try and clear their own ears out, and it doesn't really do its, well, they're not supposed to be for the ears. Don't ask me what they're supposed to be for, because I have no idea. But what they do is what you can see here. It just jams wax further in, especially if wax is a normal issue for yourself. Try and leave the ears as they are. They will try and clear themselves out. It doesn't always happen, so that's where we would usually suggest getting them cleared by, you know, a professional, an audiologist, I would say, not just any old wax removal specialist. And he's got the standard size on the tube here. So what we have to do in these cases, when it gets jammed in, depending on how long that wax has been in there, sometimes it gets very, very hard. And it's very difficult to clear comfortably, is what I would say. So we usually have to get the patient to use a bit of oil just to try and soften it a little bit. But you can see this whole thing is starting to move forwards now. Here we go. It has broken a little bit off. So I think this is the rye curette that Reese is using here now. We've gone back to the microsuction now just to take that. Hopefully that's created a bit more space now for us to remove this last piece. You can see all that dry, dead skin that's underneath this wax. There we are. Try and peel it off the ear canal again. Oh, it's just breaking away. Going to try and lift from the bottom. Oh, there it is. You could see that whole thing started to move then. There it is. A lot of hair mixed into this as well. So again, we sometimes see this where patients have, you know, regular haircuts. I mean, a lot of men tend to have a haircut every sort of 3 weeks roughly. And if they go in with a cotton bud, again, any of those loose little hairs that have been trimmed off the head, it's just going to be pushed in and stuck all inside that wax. You can see it all kind of sprouting out to the sides. But looking good otherwise. A little bit of redness to the top of the eardrum, but nothing to really worry about from what I can see. And we've got about 3 centimeters there, which is just over an inch. Well, thank you very much for watching the video, guys. Sorry, it's just myself again. Reese will be back shortly, and we will be both back on your screens again. But as always, take care of yourselves, take care of your ears, and take care of one another. And we shall see you on the next video. Thanks, guys.